and welcome back to another insightful episode of MedSynapse podcast series. I'm your host, Hetvi Shah, and today we're diving into a topic that has been a subject of debate in emergency medicine, which is the use of nitroglycerin as a pre-hospital medication in cases of acute chest pain. Is it truly a life-saving intervention, or is its effectiveness overstated? What does the latest evidence say? We are about to find all the answers to these questions. And to help us navigate this critical discussion, we have with us Dr. Saifullah, an experienced emergency medicine consultant at Merchant Healthcare in New Delhi. With over 18 years of experience, including his tenure as an ER resident at Rafah Essential Hospital in Saudi Arabia. Dr. Saifullah has managed countless cardiac emergencies. His expertise in pre-hospital emergency care makes him the perfect guest for today's discussion. So, Dr. Saifullah, welcome to the podcast, and it's a pleasure to have you with us.
Good afternoon, dear Hetvi. Yeah, thank you very much for giving me an opportunity to speak about a very common misconception, and which is being very widely being practiced till now, as what I have observed during the visiting different patients. First of all, let me introduce myself to you. I am Dr. Saifullah, as mentioned by my host. Yes, I am working as attending consultant in emergency department at busy Mulchan Hospital, which is located at Lajpat Nagar, New Delhi.
Can you briefly explain the role of nitroglycerin in management of acute chest pain?
What are the things that brought me in my mind that I should speak something about this topic? That I have encountered many cardiac cases, and some of them have been given before being present to the emergency department. What I believe that till now, as it was in practice, and it has shown basically mostly in the movies, that any patient, anytime, it has been seen in the videos and that movies, that chest pain, something has been given to keep within the tongue, which will cause the relief in the ongoing symptoms or pain, and it was just like being mentioned as a cardiac patient. So till now, the practice of giving nitroglycerin was very common, as it was a part of the prior treatment for any cardiac event, especially the acute coronary disease. So what the thing is that what is nitroglycerin, or the medicine itself, what is to be given beneath the tongue, which why it was given beneath the tongue, so it can dissolve immediately and instantly started its action. So we will move ahead. What is nitroglycerin? Nitroglycerin is a potent vasodilator which causes the reduction in the ongoing pain, precisely the chest pain, and which causes the immediate relief to the patient.
Yes, doctor, that is a great breakdown. Thank you for explaining that what exactly the role of nitroglycerin is. It's really interesting to know. So I think it's a rapid acting agent aimed to reducing the heart's oxygen demand while also maintaining the blood flow, right?
Right.
But then there's when the debate comes in. What is the current evidence supporting nitroglycerin as a pre-hospital intervention for ACS?
Yeah. As it is being considered, before there was a mnemonic for the any cardiac event, especially the heart attack, which is acute cardiac syndrome, coronary syndrome, which was called as MONA. MONA stands for M for morphine, O for oxygen, N for nitroglycerin, and the fourth one was the aspirin, which was till now. But with the further practice and evidence, it was observed that although it's very helpful in certain type of heart attack patients, but in some particular one, it will cause more harm rather than it will help the case. For example, any heart attack patients who have been in a very in the case of shock means in hypotension and bradycardia, and also if there is some specific medicine patient has taken. So if we don't know about the background of the patient or the presenting symptom, presenting case. If we prescribe this nitroglycerin, it will cause harm. Recent studies have also been done, although in a very limited area and very limited population. It was found that prior giving nitroglycerin than to the patient who has not been given nitroglycerin, it will help, but it was for limited resource and cannot be relied on. So, especially the patient, as I have mentioned, who are in hypotension with low blood pressure, it should not be given. Because what it used to do, nitroglycerin causes, in the scientific term, it causes the decrease or it will reduce the preload. What is the main work of nitroglycerin? It will cause the heart to relax a bit, to does not put more pressure to the heart, so that it will the oxygen demand of the body also reduce. But if the patient already having low blood pressure, or in the case of shock or hypoperfusion, it will worsen the situation. That's why this is the main point which I want to bring in focus, that suppose someone in the pre-hospital setup having chest pain, ongoing chest pain, but you don't know her blood pressure or his blood pressure. Yeah, that's the time it should not be given. This is the point number one. So as you ask about the evidence, so as evidence till now it's not much yet. It is under debate.
I think that's interesting. So it is like it helps with symptom relief, but it might not be a game changer while reducing cardiac damage also.
Exactly. It will not. What is the main in the pathology that leads to cardiac event? It's the blockage. As we all know nowadays, the unhealthy lifestyle, hypertension and all. So what it causes? It causes the deposition of cholesterol into the arteries, which cause the blockage. So this nitroglycerin will not cause any help to reducing this blockage. What is main role? Main role is to relieve the symptom, the very severe excruciating chest pain. So it is the main role is that.
Correct. So, doctor, how do hemodynamic parameters influence the decision to administer nitroglycerin in pre-hospital settings?
Yeah, what is the current practice? There is one association called American Heart Association. We all know nowadays we are hearing, we are listening anywhere, airport, everywhere, that sudden cardiac arrest, somebody just collapsed. And many volunteer, not only healthcare worker, also at the policemen or the military person, they have been very nicely trained to deal all this situation. So according to American Heart Association, the first line is to the basic life support practice. What is the thing that we have to look for the vitals? If not possible to monitor the blood pressure, at least we can check the pulse. Okay. We have, if no BP machine or something available, we can count the pulse. So if the pulse is very high or very low, this nitroglycerin should not be given. Okay. Similarly, another thing is the blood pressure, as I have been mentioning till now. Hypotension, low blood pressure, it should not be given. But in contrast, if there is high blood pressure, it should be given. It is really a boon. It will really help. Another presentation, heart attack with heart failure. In this, what will happen? There is some frothing will come. There will be some sound coming from the chest, like crepitation like crackles type of sound. It will definitely help. Another thing, if patient if very severely looking like drowsy, near to unconscious, we should not give this. So these are some parameters we should take into consideration before administering this nitroglycerin.
Okay, so before administrating this, you need to also look for certain other parameters we need to consider before administrating. So thank you for explaining those parameters also and focusing on that, because usually in emergency cases, these parameters are often overlooked even by healthcare professionals. So thank you for
Obviously.
So now, doctor, that also brings up to an important distinction. So how does nitroglycerin use STEMI and NSTEMI management in the pre-hospital phase?
Yeah, but first I would like to tell you that in the abroad, okay, nowadays there is very common a practice of bringing down that called defibrillator or the portable defibrillator. What it used to, it will not only help in give the shock, but also it will analyze your ECG, your cardiac rhythm. So how we will distinguish that whether it is NSTEMI or STEMI? That should be an
Correct.
ECG, right?
Hmm.
So if anyhow possible to do an ECG or at least to look a rhythm, then we can distinguish between STEMI or an STEMI. Usually, it will, as I told you before, going to the STEMI and an STEMI, we will look after the vital sign, the parameter, okay, especially the blood
Correct.
pressure and heart rate. In STEMI, usually the things are compromised, so we
Hmm.
should think quite a lot before giving the nitroglycerin. But in the case of NSTEMI, usually till now the full blown blockage is not there, and it is more widely practiced in giving nitroglycerin in the NSTEMI cases, as it will help a lot. It will reduce the ongoing chest pain, the symptom, and it will help a lot. I will give you some instances. What I found some patients. Okay, that's why I brought this topic interesting, which I thought I found different patients, but I will like to mention few of them. One gentleman, he is working as some sports counselor in the government setup. Okay, his son around 19 years. At home, he was feeling chest pain and pain radiating to arm. So his father, as I told you, the gentleman, he has given him nitroglycerin. He has given him ecosprin. He has given, even there is one tablet called clopidogrel that is to be given in the case of acute heart attack. And he brought his son, and ECG were done. So what my point is, it was not necessarily at all to give to this young boy of 19 years all this medication, which will cause definitely harm. Another one, old man, he was at some crematorium ground, okay, where he was using hypoglycemic. He has taken very little breakfast in the morning, and
Hmm.
till quite a lot of time he was standing in the sun. He was starting having dizziness, palpitation, and again he was given this NTG plus also some ecosprin and beta blocker, and he was brought in hypotension and low heart rate, and his ECG was there was no evidence of heart attack.
Oh, so it's like it is also given in wrong situations as well, where it
Exactly,
is not
exactly.
necessary.
Yeah, exactly. That's what the main my message to
Hmm.
all of who are listening to me.
That actually makes so much sense now. Now, doctor, let's talk about safety. So, are there any notable drug interaction or contradiction that first responder or physicians often overlook?
Yeah, exactly, exactly. Before it was not that much in the, because the medicines are also not so much in the practice also. So one very notable medicine is the 5-DPE, that is phosphodiesterase inhibitor, which are commonly used nowadays by the men. That is called it's potency enhancing medicine, commonly known as Viagra. So, what is the role or how it works? It's also called vasodilation, and this nitroglycerin also vasodilation. So, if you both concomitantly prescribe to a patient, it will cause further vasodilation and hypotension, which will lead to a very de- detrimental situation. So this is one medicine. At least there should be a 24 hours gap between the prescription before giving to the this nitroglycerin. Usually, what used to happen, people used to be shy. They didn't disclose this, that I have taken this particular medicine. Another is there are some means patients who have having some diseases like in the old age there is aortic stenosis, which will complicate the matter. Or if the patient already on, many patients are on antihypertensive medicines like beta blocker and calcium channel blocker. So if those are on those medication and presenting symptoms, there is blood pressure is low, we should avoid this nitroglycerin.
Yeah, I think that's some critical information given by you. So also, doctor, this actually brings us to emerging research. How do recent guidelines or studies influence pre-hospital nitroglycerin use in ACS management?
Yeah, as I mentioned, there is very little work has been done, although there are
Mhm.
studies going on. There was one Mr. Nakayama in Japan. He has done these studies in 2022. As per him, uh, we can give and it will help. The studies has shown that there is a minimal benefit in the outcome, in the mortality outcome of 1 year mortality outcome of the patient who has been given this medicine, And in comparison to the study with the patient who has not received this nitroglycerin, it has been found a bit beneficial, but although it is still in the matter of debate. And also, what is the more focus is to the training of
Okay.
the not only medical personnel but also in the general population about the
Mhm.
assessing the patient or the presenting symptom.
Yes, I think training and awareness is something that should not be neglected, even to healthcare professionals.
Of course,
Uh, so, Doctor, that leads us to the final and most practical point. So, how can emergency teams integrate nitroglycerin into standardized ACS pre-hospital protocols?
nowadays there are many training and all going on, especially the general population, even the school people, students, uh, big malls and all. So the
Mhm.
most commonly and most worldwide accepted guidelines is under American Heart Association. So first to look after the vital signs, the presenting symptom. Okay, if anyhow somehow somebody get the ECG will show where there is one very important point which I like to mention, that type of heart attack. One is a particular type that is called inferior wall MI, myocardial infarction with right ventricular. That will be evident in the ECG, very clear cut. So if that is the scenario, we should not give nitroglycerin. Okay,
Mhm.
there are specific all hospital and the general health department ministries have set their goals, that first to look after the vitals, and if needed it should be given because it will help a lot, but if it's contraindicated it should not be in the practice. Rather than the focus should be, because we are discussing about the pre-hospital care, we should focus more on the as early took this patient to their destined hospital or wherever this cath lab is available. And what more improvement can be done by looking after the quality control, to study this, how many cases have been transported, what is the effect, how many have been positively survived. So these should be the future goals.
Yeah, I think that's a great takeaway, Doctor. So thank you so much for sharing that. And as we wrap up today's session, let me tell you that this has been an incredibly informative session, Doctor. Thank you so much for sharing your insights on this crucial topic today.
Thank you very much. Thank you for me giving me a very excellent opportunity to speak. Thank you. Thank
Thank
you.
you. Thank you so much, Doctor. And to our listeners, we hope this episode has helped clarify the myths and realities of nitroglycerin use in pre-hospital ACS management. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed and stay safe.